Okay, we're just panning the room. There's nothing, no notes. Okay. Okay. All right, I'm gonna go out. Knock, knock, knock. Hi, my name's Lexi. I'm gonna be your nurse today. I'm doing hand hygiene and privacy. I'm gonna be doing your head to toe assessment today. Can you verify your name and date of birth for me?
Is Devin King, 12/05/2004.
Okay, I'm gonna check your wristband. Perfect. Do you have any questions before we get started? Okay, I'm just assessing your level of consciousness right now. You look conscious and alert to the situation. Can you tell me where you are and why you're here?
I'm at Skagit Valley College and I'm here for lab.
Okay, and can you tell me the date?
Is April 22nd.
Okay, perfect. You are alert and orientated ×4 to the person, situation, time, and place. I'm just going to, do you have any pain today?
Yes.
Okay, where is that?
In my ankle.
Okay, does anything make it better or worse?
It's worse when I walk on it and it's better if I ice it.
Okay, and does it radiate anywhere else?
No.
Okay, and how would you rate it on a scale of 1 to 10?
I would give it like a 4.
Okay, and when did it start?
It started 2 hours ago.
Oh, okay.
Yeah.
And I also want to note that you're well groomed and your posture is erect and you're dressed for the occasion of the head to toe. Okay, so now I'm going to move on to the head to toe assessment. I've done the general survey and now I'm doing the head to toe. So first I'm just going to look at your facial expressions. Can I have you smile, stick your tongue out, puff your cheeks out? Perfect. Your face is symmetrical. There's no obvious masses or unsymmetrical parts of your face, and there's no facial droopings, and facial expressions show no unsymmetry. So now I'm just going to palpate your scalp and inspect your scalp for any lesions or anything like that. Okay, so right now I'm just looking in the scalp for any lesions or redness, and there is a little bit of redness in the scalp, but the hair seems full, even. Natural hair color is brown, but it's very pretty pink. And there's no lesions other than the little red dots on the back. I'm just gonna come up. Then I'm going to come to the other side. There are no red lesions on this side. Okay, skin is appropriate to ethnicity on her scalp. She has a normal cephalic head. I'm just going to palpate your scalp. No indentations or masses. Okay, now I'm just going to move on to the eyes. I'm going to take my gloves off and perform hand hygiene before I start. And now I'm going to first ask if you wear glasses. No? Okay. I'm just going to measure your perla. Yep, I'm going to measure your perla. I'm just going to shine a light in your eyes 2 times on each side. Okay, and just the other side. All right, your pupils are round, equal, reactive to light, and I'm just going to do this and have you follow the tip of the pen light. Okay, and your eyes are accommodating as well. And now I'm going to do the 6 extraocular eye movements. So I'm just going to have you follow the tip of this pen light, and we're going to go out in 6 different directions. Okay, and all 6 extraocular movements are smooth and conjugate. And then I'm going to have you pull your eyelids down so I can look at your conjunctiva. Your conjunctiva is pink, moist, no drainage. Your sclera is white, and your irides are round and equal. And do you wear any hearing aids or have any hearing loss?
No.
No? Okay. All right, I'm just gonna put gloves on again. And I'm just gonna look behind your ears and then in your ears. All right, so first I'm looking behind the ears just to look at the skin, and the skin color is normal to ethnicity, and there's no dry skin or lesions. I'm gonna look in it. A little bit of cerium is noted. And looking behind, the skin is normal to ethnicity, a little bit of cerium. The ears are symmetrical, no lesions or abnormal masses on the ears. I'm now going to look inside of your mouth. I'm just gonna do smile first. I can look at your gums. Your gums are pink. Maybe open. Look inside. Your buccal mucosa is moist, no lesions, pink. Your tongue is moist, pink, and midline, and so is your uvula. No missing teeth. Your teeth are white. No abnormal findings. Do you wear dentures or any denture pieces? Mm-mm. Okay. And then I'm going to move on to your nose. So I'm going to have you, first I'm just gonna look. Your septum is symmetrical, your nostrils are symmetrical, your nares are pink, no drainage noted. Yeah. And I'm gonna have you cover this side of your nose and then breathe in and out, and then do that to the other side. Breathe in and out. Did you have any trouble breathing? No? Okay, your nares are patent. And then I'm going to palpate your cervical lymph nodes. So first I'm going to start with the preauricular right here, symmetrical with the ears. And then I'm going to go down to the submandibular, and then the submental, and then the posterior cervical, and then the anterior cervical. Was there any tenderness? Mm-mm. Okay, so the lymph nodes were not palpable, no tenderness, no swelling, no redness. And now I'm going to feel for your carotid arteries one at a time. Okay, carotid arteries are equal bilaterally, +4, no thrill observed. And now I'm just going to listen with the bell of my stethoscope for any bruits. Okay, no bruits are noted, and no thrill as well. Now I'm just going to have you do range of motion in your neck. So first I'm going to have you look up, and then look down, and then I'm going to have you look to the right, and then to the left, and then I'm going to have you touch your ear to your shoulder without moving your shoulder, and then on the other side. All right, perfect. Now we're going to move on to the thorax. So first I'm just going to inspect your skin. I do see some redness of a lesion right there on that side, and maybe a bruise right there. You see little red lesions on your right shoulder, and then none on your left. And then I'm going to come around to the back just to inspect. On the back side there's no lesions. I'm just going to palpate the back now. And I feel no masses, no swelling. Is there any tenderness? And I'm just gonna feel the spine to make sure there's nothing poking out. And the spine feels straight. All right, now I'm gonna go palpate the front. I'm just gonna palpate right here. No masses or abnormal indentations. Okay, now I'm going to listen to your lungs. Okay. Okay, so first I'm going to start with the left apex. You breathe in Perfect. Now I'm gonna do the right apex. Okay. Now I'm gonna do the right upper lobe. I'm going to do the left upper lobe. And I'm going to go down to the fourth intercostal right here and listen to the right middle lobe. And I'm going to go to the left upper lobe still. All right, and then I'm going to have you I'm going to lift this up. And I'm going to listen to the right lower lobe. And then the left lower lobe. Perfect. And I'm going to come to the sides on the lower axillary. And I'm going to listen to the right lower lobe on the side. Perfect. And then I'm going to come to the left side. And listen. All right, and I'm going to come to the back. First, I'm going to listen to the left apex. And the right apex. And then I'm going to listen to the left upper lobe. Listen to the right upper lobe. Then I'm going to listen to still the left upper lobe. And then the right middle lobe. And then the left lower lobe. And then the right lower lobe. No adventation sounds were heard. Breath sounds are clear bilaterally. Take my gloves off. And hand sanitizer. I'm gonna put new gloves on. I don't know why I did that. I also want to say that the carotid pulses are equally bilaterally plus 4, but I think I might have already said that now that I'm saying it. And now I'm gonna listen to your heart. So first I'm going to listen to your aortic at the left, right of the sternum, at the second intercostal, right here. This is where S2 can be heard the loudest. And then I'm going to listen to the left of the sternum at the aortic, the pulmonic. And S2 is still heard the loudest. And then I'm going to go down to the third intercostal, that's Erb's point, to the left of the sternum. All right, and then I'm going to come down here a little bit, and I'm going to go down to the fourth intercostal, and that is the tricuspid, to the left of the sternum. And then I'm going to go down the mid-clavicular line to the fifth intercostal, and that's where the mitral valve is. And this is where S1 is heard the loudest. And then I'm going to go through and listen with the bell for any heart murmurs or extra heart tones, and then I'm going to listen for a full minute with your apical pulse, and then for a full 60 seconds. And then I'm also going to check your breath. I'm going to have you breathe in and out. It's AP1-2 non-barrel chest, and your respirations are unlabored. S1 and S2 sounds were both heard. No extra heart tones or murmurs. And I'm going to go through and listen to all those points again with the bell. Okay, and then that's it for your apart. I'm gonna hand sanitize. Now we're going to move on to upper extremities. Hold on one second. Okay, yeah, upper extremities, that's what we're gonna do. Okay, so first I'm just going to put gloves on. Okay. All right, first I'm just gonna inspect and palpate, or no. I'm gonna have you lay down. I'm not gonna inspect your upper extremities quite yet. I'm going to inspect your abdomen. Okay, so first I am going to just inspect it and look at it. It seems flat, non-distended. There are some palpations in your stomach, and now I'm going to oscillate the 4 quadrants. So first I'm going to go with the right upper quadrant right here. I'm going to go to the left upper quadrant, and then the left lower quadrant, and then the left lower quadrant. Okay, and there are bowel tones heard in all 4 quadrants. Now I'm just going to lightly palpate your abdomen. Just let me know if there's any tenderness or pain. Was there any pain or tenderness? No? Okay, the belly is soft. There's no pain, no tenderness. Skin was soft and appropriate to ethnicity, no lesions, no scars, no swelling, tenderness, redness. Yeah, and then I'm going to palpate deeper, but I'm just verbalizing that. I'm not actually going to do that. And now we are moving on to the upper extremities. So if I can have you just sit up. And first I'm just going to inspect and palpate your arms down to your wrists. So can I have you just move your up and down? There's a little bit of crepitus in the right shoulder. And I'm going to do that to this one. No crepitus in the left shoulder. Skin is appropriate to ethnicity. No redness or swelling. Is there any tenderness? I'm going to have you move your up and down. No crepitus in the both elbows, and then I'm going to have you just move your wrists, and then no crepitus in the wrists. I'm going to assess your skin temperature. It's warm and dry, and I'm just going to check your turgor. No tenting, and the skin is supple. And I'm going to check your capillary refill on your fingers, while I'm also checking for any clubbing, or I'm gonna have you like put it like a diamond, like that. Yep. And it just makes a little diamond, so that's how we know that there's no clubbing. The skin color of the nails is appropriate to ethnicity. The nails are smooth. The capillary refill is under 3 seconds, and I'm going to do that to all 10 fingers. Now I'm just going to assess your range of motion. So I'm going to have you stand up really quick. I'm just going to have you raise your arms up like this and then down. And then I'm going to have you do it sideways too, and then down. Perfect. Okay, you can sit back down. Okay, and now I'm going to assess your strength. So I'm just going to have you hold your forearms up like that, and then you're going to pull against me and then push against me. Perfect. And then now you grip my fingers really quick. Perfect. Okay, your grip strength and your arm strength are equal. Both are equal bilaterally, plus 5 out of 5. Now I'm just going to check your brachial pulses. So I'm just going to feel right here for one of them first.
And I would say that the brachial pulse is equal bilaterally plus 3. Then I'm going to go down to your radial pulse. And I would say that the radial pulses are equal bilaterally plus 4. And I would count these for a full 30 seconds if they were regular, and if they were irregular, I would count them for a full 60 seconds. Okay, so now I'm going to move on to lower extremities. So first I'm just going to inspect your skin and just look and feel and palpate and make sure there's no masses or lesions or redness or swelling or tenderness. Was there any tenderness when I palpated any of that? No? Okay, I'm just gonna have you lift your leg up and then down. Perfect. And then up and then down. Okay, and then I'm going to have you just like move your ankles. Perfect. There was no crepitus noted when doing that. I'm going to check for pitting edema on your tibia and right here in 4 different places. No pitting edema noted. I'm going to check your capillary refill. I'm just going to press down. Capillary refill was under 3 seconds, and I'm going to do that to all 10 toes. Now I'm going to feel for your dorsal pedis. Dorsalis pedis. And I would say that your dorsalis pedis is equal bilaterally plus 2. And then I'm going to go to your posterior tibial. And I would say that those are equal bilaterally plus 2. Okay, and now I'm going to do range of motion. So I'm going to have you stand up really quickly. Sorry, no, you're okay. Okay, and I'm going to have you adduct your leg like this, and then, or no, abduct, sorry. You're going to abduct your leg like this, and then adduct back, and then we're going to do that on the other side. Abduct and adduct back. Perfect. All right, now I'm going to have you dorsal flex up like this, and then plantar flex like this. And I'll have you do that with the other side, and then perfect. All right, you have full range of motion in your neck, your arms, and your legs. So I can have you sit back down now. And I'm just gonna have you push against my arms, and then I'm gonna have you pull against my arms. Perfect. And then I'm gonna have you dorsal flex up and push my hands, and then plantar flex down and push. Perfect. All right. And I think that's the end of the head to toe. So, thank you for letting me do the head to toe on you. I'm gonna make sure that the bed is low and locked, and you have your call light, and there's hand sanitizer. And I'm gonna undo the privacy, and I'm gonna make sure that I document my findings.